This is Dr. Clarence Braddock, Professor of Medicine and Vice Dean for Education at the David Geffen School of Medicine. I'm delighted to share with you some insights on our new curriculum. As I think about the curriculum at the high level, it's designed to provide flexibility, a deep experience to prepare you to be an outstanding physician, and the opportunity to explore areas of passion and interest in making yourself the distinguished physician you seek to be. The curriculum starts with something we call boot camp. You might think of it as base camp. That is an opportunity to explore foundational principles in basic sciences, social determinants of health, bioethics, and basic clinical skills that will really launch you into the next phases of the curriculum. This is followed by three components: foundations of science, foundations of practice, and early authentic clinical experiences. Let me tell you about each. Foundations of Science will be an exploration of the basic science foundations of medical practice, done in an integrated way across different disciplines and across different organ systems to make sure you have a sound foundation of scientific knowledge for excellence in practice. Foundations of Practice, as the name implies, really provides you with the tools to interview patients, perform physical exams, begin to interpret diagnostic tests, and do all that in the context of medical practice, continuing to explore issues such as bioethics and professionalism, social determinants of health, and other issues that are relevant in today's practice and, importantly, in the future. Early authentic clinical experiences are a new feature of our curriculum and may be one of the most unique things we've added. In this area, students will work in a variety of different clinical settings, having very specific, authentic responsibilities that will allow them to develop their sense of professional identity, hone their clinical skills, and importantly, provide service to patients from vulnerable communities throughout Los Angeles. Over the first year, the Foundations of Science, Foundations of Practice, and Early Authentic Clinical Experiences are designed to lead students to be prepared for the next phase of training. At the end of the first year, we'll provide a comprehensive assessment using a standardized national exam, which will allow us to look at how well students are prepared on their trajectory to be prepared for their clinical experiences that follow, and importantly for later standardized national exams. After a brief break, we start the second year. The second year are the clinical rotations, or clerkships. Of course, we'll have the usual set of required clerkships, but importantly, these will be done in 4-week blocks, such that it allows substantial flexibility in both the order and sequencing of those clerkships. Between each clerkship is something we call intersession. And actually, the first intersession precedes the first clerkship. It will provide both a foundation and final preparation for clinical rotations, important practical things like how to use the electronic health record, but also begin to introduce basic science foundational principles important for those clerkships. After each 2 4-week clerkship rotation, there'll be another intersession. Each intersession is about a week long and involves revisiting basic science foundations particularly relevant to clinical practice, revisiting ethical issues in patient care, and looking again at social and structural determinants of health. In other words, the very principles that began in boot camp will continue to weave throughout the first year and be interwoven into the clinical year. At the end of the second year, after completion of clerkships, students will begin to have a protected period to prepare for taking Step 1 of the USMLE exam, and that will lead into the third year. After completion of the Step 1 exam, students will then enter one of the, again, really exciting features of our new curriculum, which we call Discovery. Discovery is that opportunity I referred to earlier to take a deep dive into an area of interest and passion that you have to become an outstanding physician, and where that end is followed by a blank, and that blank is the opportunity to distinguish and differentiate yourself into the kind of physician that you aspire to be, what you aspire to do in the world. Discovery may take the form of a research experience. It may take the form of another degree, a master's degree. It may take the form of being deeply engaged in community activity, community engagement, and advocacy. We will likely have a series of tracks. Each track will be led and organized by a group of faculty with deep experience and knowledge in that area. They will create learning activities and projects that at the end of that discovery year, that student will have become more deeply enmeshed in that area and have new skills and abilities. The other component of the third year is a longitudinal clinical experience. Think of it as a way of continuing to learn, continuing to grow as a clinician, and starting to differentiate into your specialty. Students will be allowed to do rotations with the same group of physicians at a particular site over the course of the third year. Again, providing wonderful opportunity for longitudinal learning, continued growth as a clinician, and preparation for the next phase of training. The fourth year involves a combination of electives and will end with a capstone. Electives are an important part of the medical student experience, and we're retaining that in this new curriculum. Those electives will include so-called sub-internships, specialized electives. Students can and will continue to, I'm sure, to do away rotations at places where they're considering doing their residency. And of course, in the mid part of the fourth year, many students will be sort of on the road doing residency interviews, but still, if they're not, they will be able to continue to do electives. Around the time of the match program, probably shortly after the match, we'll have a 4-week capstone. Capstones are become really a fixture in medical education. They provide an opportunity to delve into areas that are particularly relevant for the next phase of training. Leadership, such as how do you lead a healthcare team? Health system science, getting prepared to be involved with health system quality and performance improvement activities, but also continue to hone your clinical skills. So it'll be a 4-week intensive preparation, capstoning the 4 years that preceded, but also with a view to the next phase of training. So this 4-year curriculum is substantially different than what we have now, and it begins with the boot camp, a framing and a foundation, building those foundations over the first year, a rotating set of clerkships interspersed with activities to delve more deeply into the basic science and translational issues related to clinical care. The discovery year is an opportunity to differentiate oneself to become that outstanding physician, and then electives and opportunities culminating with the capstone, which will really finish out this wonderful new curriculum. We're very excited about it and hope that you are too.